Hello, I'm Dr. Aamir. Today we will discuss a condition known as Alzheimer's disease. Before we start our session, it is requested to subscribe the channel and share with your loved ones and community for health awareness.
Dr. Aamir, what is Alzheimer's disease?
Alzheimer's disease is a progressive neurological disorder characterized by memory loss, cognitive decline, and behavioral changes. It is the most common cause of dementia, impacting thinking, reasoning, and daily functioning. The disease is linked to the accumulation of abnormal proteins in the brain, leading to nerve cell damage and communication breakdown.
Dr. Aamir, what is the difference between Alzheimer's disease and dementia?
Alzheimer's disease is a specific form of dementia, characterized by memory loss, cognitive decline, and behavioral changes. Dementia is a broader term encompassing various cognitive impairments affecting memory, thinking, and daily functioning. While Alzheimer's is the most common cause of dementia, other conditions like vascular dementia and Lewy body dementia also contribute to the dementia spectrum.
Dr. Aamir, what are the causes of Alzheimer's disease?
The exact causes of Alzheimer's disease are not fully understood, but they involve a complex interplay of genetic, environmental, and lifestyle factors. Accumulation of amyloid plaques and tau tangles in the brain, along with inflammation and oxidative stress, contribute to nerve cell damage and cognitive decline.
Dr. Aamir, which part of the brain is affected by Alzheimer's disease?
Alzheimer's disease primarily affects the cerebral cortex, the outer layer of the brain responsible for memory, thinking, reasoning, and language. The hippocampus, vital for forming new memories, is often one of the earliest areas impacted. As the disease progresses, other regions controlling various cognitive functions and behavior also become affected.
Dr. Aamir, who is vulnerable to Alzheimer's disease?
Vulnerable populations to Alzheimer's disease include older adults, particularly those over 65, as age is a significant risk factor. People with a family history of the disease, certain genetic factors, and those with conditions like cardiovascular disease and diabetes are also more susceptible.
Dr. Aamir, what are the signs and symptoms of Alzheimer's disease?
The signs and symptoms of Alzheimer's disease include memory loss, especially recent events, difficulty with problem solving, confusion about time or place, challenges in completing familiar tasks. Language problems, misplacing items, poor judgment, withdrawal from social activities, mood swings, personality changes, and difficulty in recognizing family and friends as the disease progresses.
Dr. Aamir, how you diagnose Alzheimer's disease patients?
Diagnosing Alzheimer's disease involves medical history assessment, cognitive tests, and ruling out other conditions. Brain imaging, MRI, PET scans, and biomarker analysis aid diagnosis. Neuropsychological evaluations and clinical evaluations by specialists help determine cognitive decline patterns. A definitive diagnosis often requires post-mortem examination of brain tissue for characteristic abnormalities.
Dr. Aamir, is Alzheimer's disease curable?
As of my knowledge cutoff date in September 2021, there is no known cure for Alzheimer's disease. Current treatments focus on managing symptoms and slowing its progression, but they do not reverse or eliminate the underlying causes of the disease. Research is ongoing to better understand the disease and develop potential treatments, but a definitive cure has not been found yet. It's advisable to consult with a healthcare professional for the most up-to-date information.
Dr. Aamir, how do we have to deal with Alzheimer's patients?
Dealing with Alzheimer's patients requires patience, compassion, and understanding. Maintain a structured routine, use simple language, provide visual cues, ensure safety, engage in familiar activities, offer emotional support, and be flexible. Effective communication, active listening, and seeking professional guidance are key to providing quality care for their changing needs.
Dr. Aamir, what are the risk factors for Alzheimer's disease?
Advanced age, family history of Alzheimer's, certain genetic factors, history of head injuries, cardiovascular conditions, like hypertension, diabetes. Sedentary lifestyle, obesity, smoking, and limited cognitive and social engagement are among the risk factors. Addressing modifiable factors like diet and exercise can potentially reduce risk.
Dr. Aamir, what are the precautions for Alzheimer's disease?
While there is no guaranteed way to prevent Alzheimer's disease, certain lifestyle choices may help reduce the risk. Maintain a healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Stay physically active with regular exercise. Engage in cognitive activities like reading, puzzles, and learning new skills. Manage chronic conditions like diabetes and hypertension. Stay socially connected and engage in meaningful relationships. Get quality sleep and manage stress. Limit alcohol consumption and avoid smoking. However, it's important to note that these precautions may not completely eliminate the risk of Alzheimer's disease.
Dr. Aamir, what is the role of nutrients in Alzheimer's disease?
Certain nutrients like omega-3 fatty acids, antioxidants, vitamin E, C, and B vitamins may support brain health and potentially reduce Alzheimer's risk. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can contribute to cognitive well-being. However, more research is needed to fully understand their impact on the disease.
Dr. Aamir, what is the role of vitamins in Alzheimer's disease?
Vitamins, such as vitamin E and B vitamins, particularly B6, B12, and folic acid, play a role in supporting brain function and may have a potential role in reducing Alzheimer's risk. Vitamin E, an antioxidant, might help protect against cellular damage. Adequate B vitamins support cognitive processes and may lower homocysteine levels linked to cognitive decline.
Thank you, Dr. Aamir. It was wonderful knowledge shared by everyone and especially Alzheimer's disease patients and their loved ones. I wish to see you on another health topic.
Goodbye. Please share your comments and subscribe to the channel and share with your loved one and community for health awareness.